It gives me great pleasure to introduce two people as our first keynote speakers. Dr. Jonathan Kerr, who's a family physician in Belleville, Ontario, primary care lead for our, I would call him our sister LHIN, the Southeast LHIN, and also the president of the Ontario College of Family Physicians this year. We couldn't have a better president, John, so I appreciate what you do. With John is Jessica Hill, the brand spanking new CEO of the Ontario College of Family Physicians. She's hit the ground running, I can tell you. She's doing a lot of work in a lot of places and a great job for us to run this organization. They're going to speak briefly, I think, about where the college is going and start to get us thinking about where we'd like the network to go. So really appreciate you two coming today, and let's have a hand for John.
Testing that this mic is on. Perfect, thank you. So first of all, I just want to say a big thank you to Rob and Ward for the invitation to speak today. I'm pretty impressed with our primary healthcare network and council in the Southeast LHIN, but I have to say, after hearing this today about what Gordon, Rob, and all of you in this room are doing, we probably have the second best one in the province. So I'm now motivated to go back and make a bit of a difference. I just want to, again, say a big thank you to have us here in London. As many of you know, my family traveled wherever I go, and my two young kids woke up and opened the blinds today. My daughter, who's 5, said, "Daddy, where are we?" lovely to be here, lovely to be here with the snow. I also, just want to say that it's a real pleasure to really be part of this conversation. And that's something that Jessica and I really want to do. Is we're going to give a couple of slides here, but really we want to really engage in the discussion, get us thinking in small groups and then as a large group as well about some key questions, and to help populate those boards as well that Rob outlined. So with that, just talk to you a little bit about the Ontario College of Family Physicians and some of our strategic directions, and most importantly, how it's relevant to the work that you're doing here today and this year. So the OCFP developed a vision recently, and like many of you in your organizations, you may have developed a vision. You can know these are sometimes really fun processes that take many days or weeks or months. Ours took about 6 months or so, and you can see it here in front of you. So our vision is that every Ontarian receives high quality, coordinated, comprehensive, and continuing care from a primary healthcare team led by family physicians and supported by an integrated and sustainable healthcare system. I think if anyone in the room is playing buzzword bingo, you just won. It says a lot there, and really it says a lot about what you're doing here. The OCFP, just for those of you that aren't too familiar with the organization, and 50 of you in this room are family physicians and are, but there are over 12,000 family physician members. It's a very big number, really at the front line of delivery in primary care teams, whether it's family health teams, solo physicians, FIGs, FOs, SPINs, and also, having the medical school here, the great work that you're doing. We know that so many of our family physician members are so right up front in teaching medical students and residents. The OCFP has long had 4 main activities: advocacy, leadership, education, and research. And we balance our activities across those 4 as best we can. And of course, for those of you that are involved in similar organizations, we're a provincial chapter of a national organization called the College of Family Physicians of Canada. So with this, I'm going to introduce it over to, as Rob said, our brand spanking new CEO, Jessica Hill, who comes with a lot of expertise, who really has provided a spark in the work that we're doing.
Thanks, Jonathan. Can people hear me clearly enough? So, since I've been at the college since August, I have to say it's been a process of engaging with the board of directors, with the primary care networks and leads, and many other partner organizations such as the OMA and HQO, as just 2 examples. And we really started the process of saying, where does this organization want to go? What's most important for the Ontario College to pay attention to? And I think that one of the things that's most exciting for me in this position is that the board of directors and those that I've been working with are totally inspiring. I'm not a family physician, I'm a bureaucrat, I'm an administrator. But what I love to do is drive change in partnership. So the board has been very engaged, and we quickly sat down and developed a new strategic plan built on years of actually work and discussion. It wasn't as if it was done in isolation. And so the strategic directions are really here, and this will drive all of our work probably for 3 years and beyond, because they're really such core elements of what the college needs to do. But most importantly, we want to enhance your ability to practice family medicine and provide high-quality care to the patients and the public in Ontario. And we see the need for a much more coordinated effort in that respect. So working with the organizations like this that are emerging at a regional level and a local level means that we're all really walking down the same road with the same purpose. And that will mean that progress can be achieved much more quickly. So we do CME on the road, continuing medical education on the road. That's been a kind of core business of the college. But we really want to see us step it up so that there are many ways in which CME and CPD can be delivered to enhance quality and high-quality care. This can be done through multiple channels. We're having a symposium in May where the primary care leads have been invited and many other partners to help us plan the way forward to deliver the best continuing medical education we can in a timely manner, in forms and methods that really support you in your practices. The other is really connecting with members. As Jonathan has described, we have a huge membership base, but we are not connected to them. And it is a big challenge. We know that family physicians receive multiple emails from multiple organizations every day, and mostly probably go delete, 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 delete. And we actually want to be recognized as someone who's bringing value to the membership. That's absolutely at the core of what we need to do. And if we're not bringing value, then we shouldn't exist. So our goal now is to really connect with members and to make that the driving force in how we deliver what we can. So there'll be huge effort placed in member outreach. Jonathan's doing road shows like crazy. But that's not the only way. We really will be looking for your ideas about how best to reach you and make sure that we're reflecting the diversity of voices. Some of the concern is that we make sure we're hearing from all parts of the family medicine continuum to make sure that it's informing our work. So the other role that the college has played historically is influencing public policy. And this is also very important, as you can imagine, in this really an environment where primary care transformation is just involving change in many dimensions. Having left the Ministry of Health now quite a long time ago, and coming back to it again in this primary care world in Ontario, I was struck by how many tables there are. I could spend all day, as I'm sure you could, going to meetings to discuss different aspects of primary care transformation. But what I want to make sure we do as staff is that we're reflecting the voices of family physicians, not Jessica Hill's perspective, not some other staff person's perspective, but really what family physicians are saying is important. So that's where the membership voice connects to the policy piece. And then finally, we need to work collaboratively. One of the things that I believe, and I've learned from my experience, is that collaboration produces better results. Sometimes more complex results, but better results for both the patient, the public, and providers. So that will be the principle in which we operate. So just to give you some examples concretely, CME on the road, last year we held 115 events, reaching 2,500 family physicians. We want to do much better than that. But the topics that are most important, that emerge really from physician interest or provincial strategies, emergency medicine primer 1 and 2, the management of opioids, addiction and chronic pain. We have ones on shared care models, leading yourself, leading teams. And that's one's really been developed by some of the faculty that are closest to the college, including Jonathan. The next one is also something that's been developed by Dr. Franklin Martino, Danielle Martin, and Jennifer Young, called Don't Just Do Something, Stand which is really about best practices. Hugely popular, and one that we're hoping to actually develop into multiple programs. Very consistent with the Choosing Wisely campaign, which many of you may have heard of recently. The others are, we have several in the area of dementia and dementia and driving, and those are, of course, consistent with the senior strategy. So whether it's the government coming to us or emerging interests, what we do know is that some are very popular and obviously very relevant to today's concerns. Our annual scientific assembly is an annual event. Last year we had 1,000 attendees and 160 workshops. This year we're taking a new approach. We're going beyond the clinical offerings to quality improvements in primary care, which will be new. It's going to be a kind of new stream, but we think it's very important for us to offer that. And then health systems, what's changing in the environment and how to make sense of it in terms of what it means for family medicine. So I'm encouraging you to sign up. I should have had a booth here, but it's November 27th to 29th in 2014. I just wanted to mention these two networks. Often when I'm visiting communities, people aren't aware of this, which of course is concerning. But we have a collaborative mental health network, which is psychiatrists and family physicians, that has been in existence for 14 years. It's been evaluated periodically, but we're doing a complete refresh of it to ensure that it's supporting things like health links, that it's supporting other efforts to connect expertise, supporting family physicians to deliver care to mental health patients. So whether it's connects or whether it's telemedicine, these dots need to be connected to better support family physicians. We also have one on medical mentoring for addictions and pain, which again I hear is a very continuing issue in most communities, small and large. We need to make sure that's leveraged more effectively to support family physicians. So we'll be doing more with these. And these receive external funding from government for the most part. And so we want to make sure that little jewel that we have is better leveraged to deliver what it can. I've spoken to really the policy and advocacy, but I just wanted to mention that the other aspect of what we do is we do support a residence committee, so we're connected into all the universities that way. And then we also provide funding to the family medicine interest groups to generate interest in family medicine and to make sure that that word is getting out. So, over to Jonathan, who's going to lead you through a discussion.
Great, thank you, Jessica. And before we get into this, I also just want to say that your area, this whole Southwest Living region, has been really well represented on the Ontario College for a number of years. Sean Blaine, who's a member of our board for many years and one of the Leadership Development Program facilitators. Recent past president, Steve Wetmore, who gave me a call a few years ago that I won't forget and invited me to be a part of this journey of the OCSP. And of course, the new incoming president as of November at ASA, Dr. Kathy Falls. And I just saw Kathy earlier, but I'm not sure where she is. There, she's right in the middle. She's hiding on me. So again, your area has always been well represented. There's probably others in this room that I don't know about in your connections with the OCSP prior to my involvement. So congratulations to all of you. And again, seek out your local leaders, especially how the OCSP